Good day. Today, I will discuss about the 10 routes of drug administration. Objectives. Explain clearly the 10 routes of drug administration. Second, explain the mechanism through which drugs are absorbed and distributed within the body for each administration route. Lastly is to discuss the patient-specific consideration for choosing a particular route, including age, health status, patient preferences, and the nature of the medical condition. Introduction. A medication administration route is often classified by location at which drug is applied. The choice of routes in which the medications are applied depends not only on convenience but also on the drug properties. Therefore, it is crucial to understand the characteristic of the various routes and associated techniques. So this explains that knowing the 10 routes of administration is crucial for us to determine the effectivity and the fast reaction of the specific drug. The 10 routes of drug administration: ocular, inhalation, oral, sublingual or buccal, transdermal patch, epidural, rectal, otic, parenteral, and lastly is topical. Let's discuss first the ocular. Drug administration through the eyes involves applying medication into form of eye drops or ointment to treat conditions such as infections, glaucoma, or inflammation, addressing ocular concern directly. So, this kind of route is putting a medication directly into the eye to absorb by the eye tissues. Mechanism. Absorption occurs through conjunctiva and distribution is primarily within the eye tissues. So the mechanism of this route is absorbed by the eye tissues. Patient consideration. Important considerations include eye condition, age-related changes in ocular physiology, and patient compliance. This means that we need to consider if the patient has eye injury or eye infections. Also, we need to consider if the patient is young, mid, or old. Inhalation. This method involves introducing medication into the body through respiratory system, often using inhalers or nebulizer. Its preferred route for treating respiratory condition like asthma or chronic obstructive pulmonary disease or COPD. Mechanism. Rapid absorption occurs through the alveoli in the lung, leading the quick system effects. And for patient consideration, respiratory condition, age, and patient ability to use inhalation devices are crucial factors. So for the mechanism of this kind of route is it absorbs through lungs, leading to quick systemic effects. And for the patient consideration, we need to consider the patient respiratory condition, if the patient has COPD, or if the patient is old, or if the patient is young. Also, we need to consider if the patient can use inhalers or other devices like nebulizers. Oral route. The oral route involves taking medication by mouth, either in the form of tablets, capsules, or liquid. The digestive system processes the drugs, allowing for systemic absorption to address a wide range of medical issues. So in this kind of route, the medication is being applied directly from the mouth. Mechanism. Absorption occurs in gastrointestinal tract with distribution through the bloodstream. So the mechanism of this route is occurring in gastrointestinal tract and being distributed by the bloodstream, so our body can absorb the specific medication. For patient consideration, patient preference, age, and gastrointestinal health influence the choice of this route. So we need to consider if the patient is willing to take medication in tablets, liquids, or other type of medicines. Sublingual and buccal administration entail placing medication under the tongue or against the cheek, respectively. This allows for rapid absorption into bloodstream bypassing the digestive system and offering a direct route for certain medication. So this kind of route is very common, and all this route is the main focus of this route is for rapid absorption of the medication by occurring in the digestive system. Mechanism: rapid absorption through mucosa by passing the gastrointestinal tract. For patient consideration, useful in patients with difficulty of swallowing or those requiring rapid drug onset. Transdermal patch. Transdermal patches deliver medication through the skin over an extended period. This is commonly used for conditions requiring continuous steady drug levels such as pain management or hormonal therapy. Mechanism: absorption occurs through the skin, providing controlled and prolonged drug delivery. So the mechanism of this route is to provide a prolonged drug delivery. Also, the patient consideration suitable for long-term medication, patient compliance, and skin condition. This route is commonly used for like a diabetic person or for an asthmatic person. Epidural. Administration involves injecting medication into epidural space surrounding the spinal cord. This method is often employed for pain relief during childbirth, surgery, or managing chronic pain conditions. So, this route is commonly used when the mother is having a childbirth or in labor, or this is also being used in surgeries and for managing the chronic pain conditions or back pains. Mechanism: absorption and distribution are influenced by epidural space, providing localized or systemic effects. Patient consideration, commonly used for pain management during childbirth or surgical procedure. Rectal. Medications administered rectally through the suppositories or enemas are absorbed by the rectal mucosa. This route is chosen for patients unable to take medication orally or for local treatment of conditions like constipation. So, this kind of route is ginagawa siya kapag yung patient is hindi kayang lumunok or uminom ng other medications. Mechanism: absorption is through the rectal mucosa with distribution to the systemic circulation. Patient consideration, useful when the oral administration is not feasible, and consideration include patient comfort and rectal health. Otic. Otic administration refers to placing medication directly into ear, typically in form of drops or ointment. This method treats various ear conditions such as infection or inflammations. Mechanism: absorption occurs through the ear canal and is specific to the local ear structures. Patient consideration, conditions affecting the ear, age, and the presence of ear infection influence the choice of this route. So, for the patient consideration, we need to consider if the patient has an eye disease or eye infection. Also, we need to consider the patient's age and the presence of mind of the patient if the patient is totally agree with the specific route of this medication. Parenteral, IV, IM, and SC. Parenteral routes involves injecting medications directly into the body by passing the digestive system. IV or intravenous, IM or intramuscular, and SC or subcutaneous injections offer different absorption rate and are chosen based on the drug characteristic and therapeutic goals. Mechanism: drugs are injected directly into the body bypassing the digestive system. Patient consideration: immediate and complete absorption into the bloodstream, allowing for rapid onset. For the last route, we have the topical. Topical administration involves applying medication directly to the skin surface. Cream, ointment, and patches are used for localized treatment of skin condition, pain relief, and absorption of certain medication through the skin. So this kind of route is ginagamit siya mostly for external diseases or external skin infections, because most commonly this kind of route is gumagamit ng creams and ointments. Mechanism: absorption occurs through the skin or mucosa, influencing local or systemic distribution. Patient consideration: appropriate for dermatological condition, and consideration include skin health and nature of the condition. That is my report. I hope you learned something. Thank you for listening.